So, you know, depression is fascinating, and I will say this, you know, we all have reactive depression, and so as we age, yes, indeed, we can have life events. We can lose a spouse, sometimes even a child, and those are events that are going to cause a reactive depression. And depression is a stressor, and acutely, over the short run, stress makes us strong. Chronic stress, however, so chronic stress, chronic depression, actually begins to change the brain, and it changes the brain in a very negative way. There are not only biochemical changes in the brain that can be corrected with some of our antidepressant medications, but there are changes in cortisol and other stress hormones that directly impact and kill nerve cells. And where does it kill those nerve cells? Right smack in the hippocampus, right in the memory area of the brain that is most susceptible to early Alzheimer change. So we know that depression, untreated depression, is a risk factor for Alzheimer's disease. Clear as can be. A person who's depressed 2 to 3 times more likely to come down with Alzheimer's than somebody who's not depressed. So you've got to get your depression fixed. The other thing that we know about depression, which is fascinating, and we studied this when I was at the Mayo Clinic years ago, we looked at the Olmsted County population, very stable population. We looked at people that had never been depressed in their life, and all of a sudden, after the age of 60, developed depression. In 2/3 of cases, almost 70% of the time, a new onset depression after the age of 60 is actually the first sign of Alzheimer's disease. Just the mood is showing up before the memory loss. So no matter what, when we're experiencing a chronic or debilitating depression, we need to get help for that. We need to get help to reduce our risk for Alzheimer's, or if that's a manifestation of low thyroid hormone or a vitamin deficiency or something like Alzheimer's disease, we need to get that help ASAP. You can't think yourself out of a severe depression. I wish that was possible. You can't do it. Once the brain resets those chemicals in an abnormal way, you've got to use the medicines in conjunction with other adaptive methods for the depression to reset the brain chemistry. And once you get out of that, then you might be able to flush the rest of the antidepressant down the drain. I usually say symptom-free for 6 months is the goal. Completely suppress depressive symptoms for 6 months, then you may well be able to come off of an antidepressant.